Welcome to Mindfully Integrative Podcast with your host, Dr. Damaris G. Mindfully Integrative is a podcast discussing ways toward mindfully incorporating integrative health into our lives. This podcast will have informative resources, fun topics, interviews, and discussions relatable for today with a true mindful perspective in a mind-body, holistic life approach.
Hi, how are you? So we're discussing the use safely of maintenance or microdosing on GLP-1s, whether it's a natural booster for yourself or you're going to be taking it because you've already run your maintenance dose, or a healthcare provider has decided that might be a smaller dose for you because of other health issues you may have, or that it's beneficial because a small dose is actually effective to reduce your side effects, but still have some gain in the medication. And the reason this has to be done safely and under supervision is because you don't want to, one, underdose or overdose, or take something that isn't needed for you if you're not a right candidate. So most clients, patients that do this are usually on maintenance that I have seen, or have had some other anti-inflammatory or arthritic issues. So it has had major effects for that. So first off, we're talking about GLP-1s, which are glucagon-like peptides, and they are, initially were for type 2 diabetes, but now on the market for obesity, for some sleep apnea. I think there's now rheumatoid arthritis has been put in there, and then and cardiac assistance. So there's a lot of great uses for this medications if it's done properly, but they're high costs, also a lot of side effects. So the main reasons to microdose is more so for side effects and for maintenance. And to do that, you can dose limit it by what patients may need. Majority of the time, it's lower dose at a 2.5 over a 4-week period, or they're really at like a 0.8 or 1 milligram per week instead of a 2.5. Or if they're needing a little bit more, then they're around 1 milligram to 1.5 milligrams per week. Or they take a 5 milligram dose every 4 to 5 weeks. That's kind of how it's usually done, but everyone is different. So it's so personalized. Some patients need a little bit more, some patients need a little bit less. And it's also, avoiding the side effects, and it has to be done, with under supervision so that it's done smartly. Because the conventional way is just going and titrating up. And what you find is sometimes some patients really, due to, as we'll discuss further, their GI, due to their gut health, due to their genetics, due to other parts, that they may not tolerate these dosages high, and they may need smaller amounts. So that's kind of where that comes with microdosing, because microdosing is an alternative strategy. It allows fractional dosage. It's not, even though it's unconventional, it's still medication. So everything has to be, low and slow. I'm big on that, low and slow. So when you do things, when you do things low and slow, you get that kind of outcomes, and it's safer. So I find if you're safer with it, you're doing the right things. So it kind of reduces those adverse effects. It reduces those side effects. Usually the most common are constipation, nausea, headaches, fatigue. Sometimes I'll, have somebody use B12 as an additional use for B12 lozenges for the fatigue, a lot of hydration. And, I put in a lot of other parts of this of what you can do to alleviate the side effects. But, this is an option that is, helpful for individuals, and they're still getting great benefits from the GLP-1 medications. It's available for them, and they're still needing it. And obviously this has to be done under quality supervision. And if it's done properly, I think it can be done, very safely and effectively. Now, not everybody qualifies in this area. Not everybody is a good candidate for microdosing. So it really requires an understanding of that person's blood work, and them being followed up, and and a good understanding of how they're doing, the kidneys or CBC, CMP, and, where they are lying consistently and if they are being consistent. So, and just doing everything safely. So transitioning to that microdosing will help those individuals, improve like a therapeutic response. Because sometimes too, I have seen what happens is you go up higher in dosage, and sometimes the patients actually don't get a therapeutic response, and they are actually like less. And when you kind of like trick the system and start pulling back the amount, the body starts to reproduce the GLP-1 on its own, and it kind of kickstarts that again. So since it is, like we had stated, that it's a GLP-1 comes from the actively from the brain, then to signal to the stomach to the L cells to be released, that's where you're trying to trigger it back on. So the body's kind of doing its job. And sometimes when you put it too high, it like turns off the faucet, and then your body just doesn't realize it can do it on its own. So that's part of the other reason why I'm big on going low and slow. And I think it's quite effective. If you have any questions, obviously reach out to me. This is just a short overview of that, and, why patients have been, going to that as an option, and, keeping it tolerable and keeping it adequate and obviously very safe. Hope you have a good rest of your day, and I'll talk with you soon. And of course, reach out to your healthcare provider for questions or concerns. And have a great day. Make sure it's a mindful one. Thank you for listening to the Mindfully Integrative Show with Dr. Damaris Maria Grossman, family nurse practitioner. This podcast is for informational and educational purposes only and is not to substitute for professional medical advice, diagnose, or treat. Always consult your healthcare provider before making changes to your healthcare routine. Make sure to subscribe so you don't miss an episode. If you enjoyed our show, please support us by leaving a mindful review on Apple Podcasts or your favorite streaming platform. Interested in being a guest or more information? Email us at info@mindfullyintegrative.com. For resources mentioned in the show, visit our website at www.mindfullyintegrative.com. You can also connect mindfully with Dr. Damaris on her social media links found on the site. May your strength and peace guide you to find a mindful way every day. Namaste.